go and see another doctor. But sometimes you can have, like disagreement with a fellow doctor who might give you a different diagnosis or something, right?
Well, I really haven't had that experience. Usually it's like a scientific kind of discourse.
Okay.
Yes. So
Okay.
you bring the evidence and then we agree. And
All right, all right. Anyways, we're taking a look at eye infections today. So we've been looking at some eye disease. We've looked at cataract, we've looked at glaucoma, and today the focus is on eye infections.
Yes.
When we talk infection, right? I feel like it's a loose term that medical practitioners use when you can't really pinpoint exactly what is wrong. You say you have an infection, you have a bacterial infection, a viral infection, what not infection. That's what I feel anyway. But can you explain what an eye infection is?
Okay, so an infection is a disease that is caused by a microorganism, either a virus, a bacteria, or fungus.
Okay.
Yeah.
Okay.
So eye infection is any disease of the eye caused by a microorganism. Yeah.
Okay. All right. Okay. It makes sense. Yeah. But it still goes to justify my point. Anyways, what are the types that we know that exist?
Okay. So as I mentioned, you can talk about the types based on the causative organism.
Okay.
Or you can talk about the structure of the eye which has been affected. So the commonest we have is the conjunctivitis, because the conjunctiva is actually the outermost part of the delicate organ that's is experiencing the outside environment. Yeah. So a lot of times people have a lot of infections. That's the Apollo that people get with the red eye and the discharge and all that. So that's the commonest one.
Okay.
But there could also be infection on the eyelid. There could be infection of the cornea. And then sometimes the inner tissue. I mentioned the uvea the other time, the inner layer under the sclera.
Okay.
Yeah. And then also, if it's really bad from an eye injury or maybe an eye surgery, you could have an infection on the inside, in the fluid inside the eye as well.
Okay.
Sometimes there could be infection in the surrounding tissues of the eye. So like soft tissue, like a cellulitis, so the skin and then the underlying tissue around the eye could also have an infection.
Okay. But how do you know you have an infection? What are some of the common symptoms?
Yeah. So with the eye, most of the symptoms are the same with the eye infections. So the commonest ones is the redness of the eye. So normally the conjunctiva is the film coating over the eye. Yeah, so it's supposed to be clear. The cornea is supposed to be clear, but you look at the person's eye and it's all red. Yeah, so that's what the commonest signs.
Before you go on though, sometimes when somebody's eye is red, they say that wow, he's taking weed or something. No, usually when your eye is red, no, they'll say that hey, have you taken in something?
Yes. So some drugs can cause increase of blood flow to that area.
Okay.
Sometimes it could be an allergic reaction that you're having that would cause that, or
The redness.
some irritation. Maybe you were working somewhere and something entered your eye, that could also cause the redness.
Oh, okay.
Yeah.
Okay. So how do you know that this is eye infection?
So it's not
okay. Anyway,
just
let's go through the symptoms
Yes.
first, and then we can look at
it's not
diagnosis.
just the redness that I used to diagnose.
Okay.
So there's eye discharge. Sometimes it's a thicker discharge. You know, when you wake up in the morning, there's usually some small discharge.
Yeah.
Yes. So when you have an infection, the discharge is more whitish, yellowish. Sometimes it can even be greenish. You wake up in the morning and then you see that the discharge has dried up on your eyelid, so you can't even open up your eyes. Your eyes are stuck together because the eye discharge has dried up on your eyelids.
Yeah.
Yes. Sometimes you feel this sensation like sand, or there's something on your eye. You are asking people, look, but no one sees anything in your eye. Yes, that's also a sign. There could be either a lot of watering of the eye or dry eyes. There could be itchiness or soreness in the eye, burning sensation. Sometimes they are sensitive to light. Usually those ones occur when it's gone a bit deeper, probably into the cornea and that side. Blurred vision could also occur in that occasion. Sometimes too, there's swelling of the eyelids as well. Sometimes we have something like a pimple kind of swelling inside the eyelid. That's what we call a sty.
Okay.
Yeah, so that one, you see the bump on the eyelid. Usually it's around where the eyelashes are. Most often it's probably the hair follicle
That has
has
fallen.
been blocked,
Okay.
and then a bacteria has infected the hair follicle area and has caused that swelling. Sometimes to where some oils are supposed to be produced under the eyelid. So sometimes when those areas are blocked, they can also get infected, and then you see a small bump on the eyelid and it's painful. Yeah, so usually when it's painful to touch, then you know that it's also an infection.
Okay.
But sometimes there's what we call a chalazion, which is also a bump on the eyelid, but that one is not painful. So usually when it's not painful, it's usually not likely an infection. But when it's painful to touch, then that's a sign that it's an infection.
Okay, all right.
Yeah.
But how do you diagnose eye infections? Are there any tests that has to be done to confirm diagnosis?
Not necessarily. Most often it's more of a clinical diagnosis, as in you describe your signs and symptoms, and then the professional will just look and examine, and then will be able to tell that it's just the conjunctiva or it's the eyelid that's infected or something.
Okay. But let's also look at complications. If because sometimes people get these irritations in the eye and all that, and then they might want to keep it at home. Sometimes there are home remedies and all that. If you leave it untreated for long, are there any complications that could arise from it?
It depends on the type of infection, which structure is infected. So you should kind of measure it based on the symptoms. Okay, so if there is a lot of redness, there's a lot of pain, 1 day, 2 days is not going down, then you should be seeking some kind of medical relief. You should, if there's a lot of discharge as well, profuse discharge as well. So if there's a lot of discharge, a lot of redness, and a lot of pain, and it's persisting, then it should tell you that it could also lead to further damage. So once that shows the severity. So once you leave it without treating, it starts reaching to the other deeper structures in the eye. And if the infection gets to the cornea, that's more difficult to treat, and that can easily lead to blindness.
Okay, because I was going to ask that if it can actually, eye infection generally can cause permanent vision loss or damage to the eye.
It depends. A lot of the infections don't.
Okay.
Most of them are actually just viral infections and mild bacterial infections. Sometimes they resolve on their own. So it depends on the severity. But if you are still having symptoms, 2 days, 3 days is still persisting, you should seek help, because that one, the infection, even if it's not gone deep, if you leave it, it can go deeper into the eye and then lead to blindness.
Okay. All right. Any treatment available for eye infections?
Okay. So generally, if there's a discharge, you can use a clean tissue or cotton. Just damp it with some water, not cold water, like normal or a bit warm water, and then just clean off the discharge from the eye.
Okay.
You may use artificial tears if the eyes are feeling those scratchy and those kind of things. Yeah.
What's artificial tears?
Oh, it's an eye drop.
Oh, really?
So it's like water, but they've made it the consistency like the way your tears are. So you
can get it OTC?
Yes, you can get it over the counter at any pharmacy.
Okay.
It's not a prescription drug. So just if you're having dry eyes, you can just use it. Even when you use the laptop too much, sometimes your eyes feel dry. You can use the artificial tears.
Okay.
Yeah. All right. Then sometimes if maybe you want to use some pain relief, I don't prescribe it often, because pain actually tells you if it's getting worse or not. Maybe you can take some paracetamol or something. Yeah, but usually I think you should leave it, because the pain is a marker for if it's going away or if it's getting more severe.
Okay.
All right. If you are wearing contact lenses, you have to keep the contacts off whilst you're having those symptoms of the discharge and the pain and those symptoms.
Okay.
And then avoid rubbing the eye or scratching, those kind of things. You should avoid
It's
doing
difficult to avoid though. If it feels itchy and
Yes,
stuff,
so
Charlie. Sometimes the way I rub my eye, we can hear me.
you can use the artificial tears.
Okay.
Yeah, but don't be rubbing it because you probably worsen the situation.
Okay.
And if you have a style, a swelling, you can have a warm, what we call a warm compress. So you have a towel, a clean towel with some warm water, and then you press it on over the eye. You can actually do that in most of the infections. Just use the warm compress over the eye for like 10 minutes, about 3 to 5 times a day.
Okay.
Yeah, and then you see how it goes. Sometimes once you do that and you keep cleaning the eye, the infection should clear by itself, especially when they are viral infections. They go by themselves.
Okay.
Yeah.
Okay. All right. Any other, or that's it?
Well, some people say green tea bag. So like green tea has some bacteria killing properties. So
You put it on the eye?
yes, so like you just put the green tea bag, not cold water, like
Warm.
not hot water too. You're not
Warm
making
water.
tea. Just water that's like a bit warm, and then you put it over the eye. So it's the same as the warm compress, but instead
Okay.
of a towel, you're using the tea bags over your eye. They say it helps. I don't know.
But usually, how long would it take for an infection on the eye to clear if you are treating it?
If you are treating it by 2 days time, the symptoms should stop. But you are supposed to continue the antibiotic for I think 5 to 7 days. But usually, let's say 5 to 10 days, your infection, if you are treating it, should be gone. The viral infections, they won't give you antibiotics for that. They'll
Okay.
just give you maybe something to soothe the itching and all those things. So those ones, it should take like a week or so. At most 2 weeks, but it should go by itself.
I don't know if you mentioned it though, because you mentioned that the infection could be viral, it could be bacterial, it could be
Yeah,
fungus.
yeah.
How are you able to differentiate? Is it from the diagnosis?
Yes. Okay. So usually the bacterial infections are the one that produce more of the discharge.
Okay.
Yeah. So viral, it will probably make your eye more watery, but not so much of the discharge. But the bacterial that has more of the discharge, whitish or yellowish discharge,
Okay.
sometimes greenish.
Okay. Okay.
Yeah.
Anything we can do to prevent getting eye infections? We're wrapping up.
Yes. So hand hygiene is very important.
Hand hygiene.
Hand hygiene.
Okay.
Yes. So actually, a lot of these viruses and then the bacteria that cause are those that cause those upper respiratory tracts, the cold and all. Is this those same viruses or from that same family and bacteria?
Even sometimes when you get cold, you get watery eyes and all that.
Well, not exactly.
No, I mean, I
Yes.
experience that. When I have cold, I have that. So I don't know if it's coming from that.
No, not necessarily. No, but the thing is, a lot of those things are from our hands. So
Okay.
you are touching the table, you touch the doorknob, then you scratch your eye. And a lot of times people do that. They don't even notice that they have touched their eyes.
Yeah.
Yes.
Yeah.
So as much as possible, be washing your hands, using sanitizer as much as possible. Don't share personal items like pillowcase, towels, those kind of things. The eye makeup, mascara, those things that touch the eye. Don't share those things because you can pick infections
Infection.
that way.
Okay.
Don't contaminate the eye drop bottles. A lot of time people will take the eye drop and they'll be touching the top, that tip there. That is not supposed to be touched. You are giving someone, putting on someone's eye. Then
You are touching the tip. No.
Yes, you don't touch the tip.
Okay.
Yeah, so normally you just hold it up.
Otherwise, you think that you're using the eye drops, but you're actually infecting it with something else.
Yes. So, and also to avoid reinfecting yourself. So maybe you had an infection, you have to change your beddings and all those things. Wash your towels and all those things with hot water and all that. Avoid using makeup, eye makeup, especially when you are having when you have an infection or you previously had. So if you had an infection and you had this makeup set, you have to get rid of that set.
Oh, really?
Yes.
We're going to have to buy a new one.
Maybe
That's
you
going to be
want
expensive, right?
Maybe you want to disinfect. I don't know.
Okay.
Yeah. So you should avoid. I think people do a lot of these colored contact lenses just for fashion and all those things. They can be a bit dangerous, especially when they are not very clean. They are not cleaned very well and all that. So if you can avoid it, and you don't have to wear those kind of things. Yeah. And also, I think that there's some eye drops that people try to use to change the color of their eyes.
Why do they want to do that?
I don't know.
That's also fashion.
I think so.
Hey.
Yes. It's actually it's quite harmful. It can cause scratches on the cornea. Yeah. So it can lead to infection. It can open a way for infections.
Hey, be my eye. I don't want to touch it with anything.
Well, the ladies are more into that, so maybe you can ask your wife.
No, she doesn't do that.
Yeah, so avoid people who are also having these eye infections as well. Not like don't talk to them, but I mean,
Where shades we are talking to them.
yeah. All right. Yeah. So
Okay.
basically, that's that.
All right. Thank you, Doc, for giving us some education on eye infections. I think that would do for the month, right?
Yeah.
Yeah. Thank you very much. Hopefully, we get to meet next week, Monday, for another exciting edition of
Sure.
Hello, Doc. You have a great week.
You too.
All right. So that was Dr. Emefa